one of the things I'll tell you, I just got off the phone maybe 15 minutes ago with a gentleman who had fasted with us in the past, but his wife was really kind of not ready to make diet and lifestyle changes. So his early success was somewhat limited because, he didn't get encouragement. He kind of got a little bit of resistance at home. And he told me that one of the things that happened was he got the book and his wife actually read it. And now not only has her attitude changed, she's actually booked a stay at TrueNorth Health Center. So he's feeling very optimistic that his adherence and compliance will be even better because now his wife seems to be convinced that, it's a reasonable thing to do. So I think that was very gratifying to hear that at least convinced one person that fasting wasn't ridiculously insane and that might have utility and benefit.
Well, you bring up a great point, Dr. Goldhamer, how difficult it is for people, whether it's, whatever their goal is, that when they're in an unsupportive or an unclean environment.
Yeah, it's very difficult even in a supportive and clean environment because the world is not supportive and clean, even if you manage to create a little nest within the world that's supportive. When we wrote Can Fasting Save Your Life, part of the intention was to do two things. One, to bring the information people together that people needed to, make sure if they're going to fast, they do it safely. But also to convince physicians that fasting and this type of dietary approach might have utility, so that fasting wasn't an insane kind of a thing, that there was science to support it. And I think that it won't make it easy for people to live healthy or fast, but it does make it easier if there's factual and compelling information to show people that at least it's a viable alternative.
I noticed you've been doing a lot of podcasts lately, not just Rich Roll, but people that are not necessarily plant-based. Can you talk about some of the shows that you've been on and how have those been going when the people are not largely vegan or plant-based?
Yeah, I've actually been doing a lot of shows where the authors tend to be paleo or keto type oriented, athletic, short-term muscle gain type thinking, and usually advocating high protein, high fat diets. What's interesting is that many of them themselves, from following their own advice, have developed health problems. And so they've been much more amenable to discussing the fact that high protein, high fat diets may have a fasting mimicking effect and blunt hunger and allow for some short-term weight loss, but they're not necessarily a good long-term health strategy. So we have to keep in mind that some of the advice that's given may work really well if all you're interested in is short-term weight loss or short-term muscle gain. But you have to worry what happens to people that follow that advice for years or decades. And of course, we know what happens to people on high-fat, high-protein diets, especially animal-based high-fat, high-protein diets, is they get all kinds of health problems. And that's actually what's happening to a lot of the people now that have been following these high-protein, high-fat diets for a while. They're starting to get the problems with gallbladder, GI problem, gastroparesis. They're developing their autoimmune activation and difficulties. They got some short-term benefit because they stopped eating refined carbohydrates. And any diet that stops the sugar, the oil, and the processed foods is going to get some benefit. Because let's face it, AJ, these people were eating animal foods 3 times a day anyway. They're eating at breakfast, lunch, and dinner. How much more animal food do you think they're eating when they go on these diets? They're getting rid of the refined carbohydrates that's responsible for the benefit, and they're making an error of attribution. They're thinking the benefits they're getting is because of the higher fat, higher protein diet. The benefits they're getting is because they're not eating refined carbohydrates, and some of them are losing some weight and all that. The point is, the benefits you can get without having to compromise your long-term health, and that's what we try to advocate by encouraging people to eat a whole plant food, SOS-free diet. They get the hunger blunting mechanisms, their blood sugar levels stabilize, they lose the weight, but they can also sustain it long-term.
That is so true what you said, that it is not because of the addition or the inclusion of animal products that they're having success. It's for the exclusion of the sugar, the flour, the refined carbohydrates.
Right. And again, we've got to have that's one of the advantages to using science, is that, it takes into account sometimes not just short-term, but long-term impacts.
Great. You ready to jump into the questions?
Always ready, AJ.
All right. Well, Jim, he has four. So we'll start with the first one. What indicators do you follow to determine when a fast is over?
Okay, that's a really good question, and there's a number of variables that we use. What we don't have are reliable, non-invasive biological parameters that tell you definitively this is who should fast, this is when they're done fasting, etc. We're working on that. So what we have to do is combine clinical parameters and laboratory parameters. So there's some very clear-cut indicators that fasting is done. That is, we have parameters. In fact, we lay them out in the book. For example, potassium levels and sodium levels. We monitor those during fasting, and we use those as rate-limiting nutrients. For example, it's easy to monitor those things, but there's 10 or 15 or 20 other things that you're not monitoring that either may be more difficult to monitor or not available to monitor. It turns out, though, if potassium levels are okay, sodium levels are okay, those downstream issues are also generally okay. So that's one of the advantages to having biomarkers. You monitor those. If they get below a certain threshold, we terminate the fast. And that prevents us from running into problems with things we're not able to monitor. So it's important to understand what rate limiting nutrients are in fasting. And it's also why you don't supplement when you're fasting. So if you give people, say, sodium during fasting or potassium, or you follow some of the advice you see on the internet, what happens is you no longer have reliable rate limiting nutrients that you can monitor. And then people can get into trouble, sometimes serious trouble, because they run into depletion issues because they've artificially been supplementing isolated nutrients. It's an example of letting your arrogance exceed your ignorance. And so we don't do that. And so we know that the parameters we have are reliable because we've been using them for 40 years. We've had 25,000 people do it and 25,000 people walk in and walk out. So clearly they've been a generally reliable protocol, and monitoring those nutrients is an important issue. And that's why it's a lot easier to tell a person, look, your fast is over because you've reached one of these protocols. Other protocols, though, are not biochemical. They're emotional and circumstantial. Some people, have like jobs and lives, and they only have so much time. And so you have to work within the constraints that people have in terms of their time availability. And some people, it can be emotional limitations because fasting can be a very intense and difficult process. And so you don't want to push a person beyond their ability to adapt. And so sometimes the fast has to break because of circumstantial, sometimes it's emotional, sometimes it's physiological. Our job is to make sure that all of those are respected. And it's pretty clear that we've been doing a good job of that because, again, everybody that's walked in has walked out. So we've managed to not screw it up.
Dr. Goldhamer, if somebody is fasting at home, which I know you don't recommend, and you've fasted tens of thousands of patients at the center, how would they even know when to end the fast?
Well, they can fast at home. In fact, we recommend everybody fast at home every day for 12 to 16 hours. And then as far as longer term fasting at home, if they're going to fast at home, they still need to follow the same protocols we would follow at TrueNorth Health Center. So when we have patients fasting at home, they still need to have a relationship with a local doctor, so a history exam and lab, to make sure they're a good candidate for fasting, that they have baseline data established so you can tell the difference during a fast from a positive healing crisis and a problem. They still need to rest during fasting to make sure they don't deplete their lean tissue, that they're primarily burning fat and preferentially visceral fat. And most importantly, they need to recover carefully, where they spend half the length of the time progressively refeeding. So if they have a 10-day fast, it takes 5 days of programmed refeeding if they're going to have a safe and effective experience. The mistake people make, AJ, at home is they're not a good candidate for fasting, or they don't monitor their fasting adequately, or they don't rest adequately, or they don't refeed properly. Any one of those mistakes can become serious or even potentially fatal on a longer fast. So it's important, if people are going to do it at home, they do it right. And the problem is, a lot of the people that have trouble with the diet and lifestyle aren't necessarily always the best candidates to do this at home. So we prefer that patients fast in a controlled setting that's designed to support that. But if you are going to fast at home, First of all, read Can Fasting Save Your Life? And then make sure your doctor reads Can Fasting Save Your Life? Because that book gives them the information they need to make sure if they're going to do a fast, they don't screw it up.
Dr. Goldhamer, I'm sure there's people that come to the center that have come to the center that weren't eating even a plant-based diet or let alone an SOS-free
Yes.
one. So are their fasts different than somebody that's eating like you? And how
Yes.
successful are people fasting if they go back to eating an animal-based, oily, high-fat, high
Right.
processed food diet?
Well, the first question is, do people come in having eaten conventional diets, and how do their fasts compare to people that are, say, on whole plant food SOS-free diets? So the people that come in eating animal-based foods or taking lots of medications, for example, have much more entertaining fasts, tremendously more interesting to me because they go through all kinds of difficulties. Whereas people that come in on plant-based diets tend to have very kind of boring fasts, not a lot of exciting healing crisis. They just do the fast, the body heals up, and that's it. So I have a preference for people that are making more radical changes just because they get such interesting detox symptoms and stuff. It's quite, as I said, it's quite entertaining. But for people that want to have a pleasant fasting experience, the best way to do that is to prep properly. That means eating exclusively whole plant foods for several days before fasting. In fact, we recommend fruits, salads, and steamed vegetables only for several days before fasting. And if people do that before they come to the center, then we can get to work more quickly. If they're coming in off Taco Bell, then we're going to want to feed them at the center for a few days to be able to get that system or get their system better prepared for fasting. One of the most difficult things people come off of, believe it or not, AJ, is caffeine. Caffeine withdrawal, that is a drug that's very addictive. And when people come off caffeine, they get headaches and they can be quite miserable. So we always try to get people to wean those drugs like caffeine before they come to the center so that they don't have to be as miserable and they don't misattribute their being miserable to fasting, but rather to what it actually is, which is drug withdrawal.
Dr. Goldhamer, you talked about medications, and if people are fasting at home on medications, how are they able to do this? Because they can't take themselves off some
Well,
medication.
they're not going to be fasting on medications. If we have to stay on medications, then we would do a modified program, a healthy eating program, or maybe a juice fasting program. But remember, AJ, if they're fasting at home, they're working with a local doctor who's done an exam, who's ordered lab, that's as it's laid out in the book. And we have doctors that do remote coaching support, and they can coach the patient and their doctor. So they're still going to have, if they're going to be weaned off medication, it's going to be by the doctor that prescribed the medication. And many people are not being medicated for their health conditions. They're being medicated for the diets that cause their health conditions. So as soon as you change the diet, the need for medication changes. Again, if people are sick, if they're on complicated medications, we're going to have them come to TrueNorth Health Center to go through that process of withdrawal, unless they have a supportive doctor that can help them, do that safely. You don't fast on medications. So AJ, for example, something like non-steroidal anti-inflammatories that people may take and get away with. On the fast, they can cause damage to liver and kidneys. Many of these medications, people take steroid medications, anticoagulant medications, arrhythmic medications, et cetera, would be very dangerous to just arbitrarily discontinue. That could actually result in a stroke or a serious problem. So we don't want people messing up their health. We want them improving their health. And that's why we've written the book, and that's why we give the advice that we do.
Right,
So,
but I think you're assuming that everybody that's fasting at home is having a medically supervised fast. I don't think that's the case.
well, if they're going to fast at home, we recommend number one, they determine that they're a good candidate for fasting. We can help them with that remotely. And we offer a free conversation on the phone with me to do exactly that. If they fill out the registration forms, we'll review that and say, hey, wait a second, fasting, is good for you or may not be good for you. But they still have to work with their local doctor in order to get baseline lab work done and to have somebody available to deal with complications that might arise. Our coaches can guide them on the day-to-day, challenges of fasting, but there still has to be a physician involved on their end. That's only common sense and logical. Now, sometimes I know you're going to find this shocking, but people don't always do the common sense and logical things. But those are people that tend to get into trouble and make mistakes. So we try to avoid encouraging that.
Thank you. Okay, well, here's a couple more questions from Jim, because I believe he is fasting at home and I don't think it's under medical supervision, but he wants to know, why do you use fruit juice as the first refeeding when it's known to be very high in sugar? When I fasted, I didn't get fruit juice at all.
Yeah. No, we use fruit or vegetable juices or broth. It depends on the patient and what you're trying to do. Remember though, when we are coming off a fast, we want to introduce about 600 calories, wherever it's from, vegetable juices, fruit juices, whole fruits, whatever, because otherwise you're not getting out of the fasting process. You have to give the body enough glucose to meet its primary basal glucose needs. Otherwise, you're going to break down lean tissue. So that it's about how to get 600 calories in. Now, there's a lot of ways to do that. The advantage to using fruit or vegetable juices is there's no fiber. So if you run into difficulties initially with refeeding, it's short-lived. If you put a large fiber load in there, then it drags out that problem. You can get into problems with vomiting or something, and that can lead to dehydration. There can be problems. So we use this protocol because it works. This is the way to terminate fast, whether it's 2 or 3 days or 20 or 30 days fasting or longer. Now, we don't recommend people doing long-term fasting that is over 3 weeks in a non-supervised setting. So most of the people doing fasting at home are relatively shorter durations, and they're hopefully people that are good candidates for fasting. And I have to say, it's harder for people to make good choices, even when they know what to do at home, than it is in a controlled setting. So for most people, fasting in a controlled setting has advantages.
Thank you. Okay, and his next question is, why stop at 40 days for the fast length? Why not
Yes.
fast longer?
Yeah, well, the guy I trained with, AJ, used to fast people routinely up to 60 days. In fact, he had one gentleman he fasted for 103 days. And when I got there to Australia 40 years ago, I asked Dr. Burton, how come we're only fasting people now generally around 40 days? Why not the longer fast that you used to do? And he said, because of sleep deprivation. And I said, oh, I didn't know patients had trouble sleeping after 40 days more so than shorter fast. He goes, no, not the patients, me. And he said that he used to have problems because, when you get longer than 40 days, it gets really delicate, the electrolyte balance and other things. It takes a much higher degree of control and monitoring in order to continue to do it safely. And he said he used to worry so much about patients that were on these very long fasts that he wasn't sleeping well. So he decided to eventually shorten the fast to not doing any of the really long fasts and sticking to 40 days or less. And so that's the way I was trained. We've only had a handful of people that we've had to go longer than that. And our focus is, if we have to do more than that, what we'll do is we'll break the fast, recover the person fully, and then do it again, and do another fast. And that seems to work pretty well. It eliminates some of the complexities of prolonged recovery.
Thank you. Okay, he has one more question. I know you're going to love this one. Why do you still talk about low fat when that is old propaganda and high fat is the new science? I don't know where he's getting his science.
Well, first of all, we're not technically recommending a low fat diet because the diet that we're recommending is around 15 to 18% of calories from fat, because it does have things like seeds or nuts or avocado or other, plant-rich sources of whole fat. And so it's not actually a technically less than 10% of calories from fat diet that we're routinely recommending. So that's number one. Number two, the new science quote of high fat is just that there's a whole lot of people advocating fasting mimicking diets, which obviously if there's no carbohydrate, it's going to be a high fat diet. That's the only, you have fat, protein, and carbohydrate and alcohol are the only sources of calories. So unless you're advocating an alcohol-rich diet, it's going to be a diet high in fat. And that is not something that we're recommending. Now, is it true that if you go on a high fat, high protein diet, there's a hunger blunting mechanism? Sure. It's just like in fasting. You don't feel as hungry. Is it true that a high fat diet, a ketogenic environment, has a disadvantage to, say, cancer cells that require higher glucose needs? Yes. But that doesn't mean you go on it permanently or necessarily even long term. Any more than we would say, well, you'll just fast now forever. We'll just put you on water fast and that's it. Because that's not going to work long term. That's a short-term intervention. It's a therapeutic intervention. So I don't think there's a science supporting long-term health sustaining approaches that rely on high animal fat, high animal protein diets. That's just not certainly something I would agree with.
Yeah, well, it'll be interesting to see if the person that fasts and has success goes back to that diet, how their health fares. Okay, so we've got questions, many questions that have been submitted in advance, and please go to chefaj.com if you'd like to know how to submit questions for the guests. And the first one here is from Kim. She would like to know, can water-only fasting help with frontal fibrosing alopecia? Her sister's had this condition. She's 54, 4 years into menopause, and also has Hashimoto's thyroiditis. So could fasting help Kim's sister?
Well, let's talk about those two. Alopecia, there's lots of different forms of alopecia. And unfortunately, there's lots of different causes. Like for example, you can get problems from thyroid imbalance. You can get problems from hormone imbalance. You can get problems from stress. So even emotional stress can lead to alopecia. So the question is a little bit complicated because fasting is not just fasting. It's also often resting. It's also often associated with dietary change. So some of the patients that we see that get improvement, we don't always know if it's from the fasting, it's from the diet change, it's from reduced stress, it's from, could be a lot of things. But yes, many patients that have experienced problems with alopecia have experienced improvements as a consequence of the overall diet and lifestyle improvement. So what does that mean? The chances of improvement are better the worse the person's diet and lifestyle is. So a person that smokes and drinks and is under stress and eats nothing but greasy, slimy, fatty, dead, decaying flesh is probably more likely to improve than the person that's on a whole plant food SOS-free diet that gets plenty of sleep and exercise and has a really peaceful life. Now, that doesn't mean that both wouldn't potentially benefit from fasting, but obviously the more room there is for improvement, the more optimistic we are about short-term changes. The red flag for me, AJ, is always, what do you do with a healthy person living healthily that has a problem? Those are the ones that are the most difficult patients to manage. Those are the most challenging patients because people that are living healthily typically don't have as many problems, but sometimes people living healthily do develop problems, including very serious problems. Now, in fairness, people that develop serious problems that are living healthily typically are the ones that do quite well in managing those problems, and they have good long-term outcomes. But, sometimes all I can think of is, this person shouldn't even be having problems, by virtue of their diet and lifestyle choices. Unfortunately, there's a lot of things that you can't control. You can't control always your environmental exposures. You certainly can't control your genetics. You can't control the cumulative use and abuse that occurred previous in your life. And you can't control sometimes your personalities. Like some people are way more vulnerable to, for example, gaining weight than others, or some people are more vulnerable to the effects of stress than others. Some people just have bad luck and they breathe the wrong stuff. They got exposed to the wrong medication. No fault of their own. They followed some medical doctor's advice that gave them vaccinations or God knows what, that they had a very untoward reaction to. So it's not always possible just because somebody's been living healthily that they're going to be immune to everything. They're not. Bad things happen to good people. It's just percentage-wise, odds-wise, it's a lot less. And if you're living healthily and you happen to have bad luck, the chances are you're going to heal better. For example, if you get in a car wreck, even if you're a vegan SOS-free person, you can still get in a car wreck. But chances are you're going to recover better than the person that's 50 pounds overweight and living on a poor lifestyle diet. So it's kind of like the odds you're playing. You're trying to increase the odds, but there is no absolute immunity, unfortunately.
Thank you. Yeah.
Yeah.
If
I
only.
don't think that had anything to do with the question, did it?
No, has fasting helped that problem, that specific?
Yeah, it does actually. It can, but again, I don't know it's specific to fasting. I think it's the combination of the diet and lifestyle that sometimes will generate improvement. It's also like Hashimoto's thyroiditis. Let's talk about that because they asked about that. So that's the most common cause of hypothyroidism. And the reason people have hypothyroidism is their immune system attacked their thyroid. That's what Hashimoto's thyroiditis is. Your immune system attacks your thyroid and you stop producing these necessary hormones. And you will feel like crap. Hypothyroidism, not conducive to healthy, happy living. And so what the medical profession does is they'll replace the hormone therapy Just like they might replace insulin in people that are diabetic, they'll replace the thyroid. There's a problem though in doing that. If you take more thyroid medication than you need, you will be at risk for osteoporosis and other downstream problems. So the important thing is you be on the least amount of thyroid you need to maintain normal levels. And a lot of times monitoring is necessary to do that because the healthier you get, the less thyroid you tend to need. Sometimes with fasting, if you get people early on in the disease, it actually reverses it and they're able to normalize. But if they've been on thyroid medication for a long time, it's very unlikely that you'll completely eliminate the need for all replacement therapy. But you will likely reduce the quantity that's needed. And so you have to monitor, you have to work with a doctor that's used to people actually getting well. So they're willing to continue to monitor it because most doctors never, it just gets more and more and more. They never see anybody get well. And so with Hashimoto's thyroiditis, you identify the food factors that tend to make it worse. We know that the gene, the HLA-DQ gene that's associated with Hashimoto's thyroiditis, is the same gene associated with gluten sensitivity. And so the theory is the people that are sensitive to gluten, 1% get celiac disease. The immune system attacks the intestinal tract. And another percent, it may not attack the intestinal tract, but attacks the thyroid. And so for those people, eliminating gluten seems to be a good preventative and also treatment component. The proteins in dairy products seem to be a factor, and then general dietary issues as a whole. So no dairy, no wheat, no sugar. And then if you use fasting, sometimes it'll improve function where you can reduce your need for medication, and then be on the least amount of medication necessary to maintain normal function, which is determined by blood test monitoring.
I was on thyroid medication for 15 years and I was still able to get off, reduce it a little bit when I did my fast. Dr. Goldhamer, you're
Right.
frozen. Can you hear me, Dr. Goldhamer?
Yes.
Oh,
I can hear you.
You're unfrozen now. Okay, perfect.
Okay.
Thank you. Yeah, so I still was able to reduce the amount of thyroid medicine even after being on it for a very long time after the water fast. Thank you.
Well, you know, think about this, AJ. When people lose a lot of weight, for example, there's less of them. And so it's likely there'd be proportionally less medications that are needed. And when people get healthier, their natural thyroid function may improve. I'm just saying, if you've been on medications for more than 10 years, you're probably not going to get so much improvement you completely eliminate the need for medication. So it's not something you just arbitrarily stop.
You know what I'm curious about, Dr. Goldhamer, because you had mentioned that there are people that come to you that are already following a health promoting diet and having some challenges. Okay, you're frozen again. What can help sometimes, Dr. Goldhamer, is turning your camera on and off and then turning it back on.
Okay, I will do that.
Okay, now you're not frozen again. Okay, but try the on and off trick. That sometimes works with me. Thank you.
So what's interesting, AJ, is I can hear you all the time, but to me, you're frozen.
Okay, I'm going to do the same trick. What about now?
Now you're unfrozen.
Yeah.
I think it was you, not me.
Okay, of course, it's always my fault. Anyway,
it's your fault.
Thank you. Dr. Goldhamer, so do you ever know how many people come in on a health promoting diet or come in just even on a junk food vegan diet versus the standard American diet? The reason I'm asking is I'm curious about something because you talked at the beginning of this broadcast about how the reason people have short-term success like on a keto or paleo diet isn't because of something magical or great about animal products, but because of the elimination of the processed carbohydrates. And I'm curious for the people, not the people that are already eating a health promoting diet where fasting can make a huge difference. But the people that come in on a standard American diet, I'm just curious, is it the fasting that's so magical or is it because they're not eating crap anymore? And could some of those people maybe have had success if they were just willing to follow the health promoting diet in the first place?
Well, absolutely, AJ. In fact, one of the things that happens frequently is, we do a lot of phone coaching now where patients work with us on the phone remotely. And I know Dr. Vares has had a number of patients that were scheduled to come in to fast, but by the time they got working with her on the phone and they cleaned up the diet, they resolved the problems. We didn't have anything left to have to fast them with because their blood pressure had already normalized and their blood sugar had already normalized. And, again, she can't help it because that's the kind of doctor she is. So, but, many, many problems resolved just by following the diet and lifestyle advice. We tend to get the people that either have trouble following the diet and lifestyle advice or they followed it, but it's not enough. That's why Dr. McDougall used to call us the punishment, because if a person came in and did his program, but their blood pressure was still too high, he would apologize to them and send them over to us to do the fasting and stuff, because the fasting is kind of like turns the heat up quite a bit, makes things happen a lot faster.
Thank you. Here's a question from Mindy. Dr. Goldhamer, hi. On a recent interview, I heard you say that water fasting can be beneficial for patients with chronic Lyme disease. Have you had success water fasting Lyme disease patients at TrueNorth? And if so, do you have any of the data on the subject? Thanks.
Yes. So yes, as a matter of fact, we live in an area where Lyme disease is very prevalent. And so we see a lot of patients that have had Lyme exposure. And acute Lyme disease is generally treated initially with antibiotics and then fasting and dietary change to deal with the consequence of the antibiotics. But where we see a lot of use of fasting is in patients, they've already had often massive treatment with antibiotics, often IV antibiotics for chronic Lyme disease. And these patients now are thinking that their symptoms are related to Lyme disease, but it's actually more autoimmune disease resulting from the treatment with long-term antibiotics. And then when they stop the antibiotics, they get an activation, and they're assuming it's the organism, when in reality, it's an activation of their immune system. And so those patients often respond well because we get them off their drugs, do the fasting, reboot their autonomic nervous system, and then oftentimes they're able to make dramatic improvement. And we're also seeing the same kind of thing now in people that have had vaccine injuries from COVID-19, or they've had long COVID. They had COVID, but they never recovered. And so they have the brain fog, the fatigue, the joint pain, et cetera. And AJ, we just published a paper in a peer-reviewed journal on successful treatment of long COVID with 2 weeks of fasting. This is a person who had a 2-year progressive history of long COVID who had a dramatic improvement after fasting with us. And we're also seeing that in vaccine injured patients. People that have had vaccine, then they get these problems, and we use the fasting, and it's been very helpful at reversing that. So we're actually quite optimistic that the mechanism is probably similar, both in autoimmune disease as well as these vaccine injured patients.
Perfect. Thank you. This is from Joe. I fly from Los Angeles to London once a year, and I dread the jet lag. I feel like a depressed zombie for days after each flight. And altogether, with transportation to and from the airport, it takes about 22 hours from home to my initial destination. Would
Yes.
water-only fasting during those 22 hours help? And if so, what should I eat to break the fast?
Okay, well, yes, reducing caloric intake and not eating and flying definitely seems to help people. I wouldn't necessarily do a water fast. There's often delays and other things, and you don't want to be dehydrated. In fact, dehydration is a big part of the reason people have so much trouble with jet lag. And because the environment on the plane is pretty dehydrating too. So what I would suggest you do when you're traveling is don't eat, or if you do eat, eat very low caloric density, high water content food. So fruits and vegetables. And conveniently now, you may not be able to carry liquids on a plane, but you can carry, whole fruit or bananas or things of that nature. So I would suggest trying to restrict eating during traveling to just fruit or vegetable materials, and staying hydrated, making sure you get up and move around as frequently as you can. The prolonged sitting may increase risk of everything from DVT on down, and also tends to be a problem for people. Also, I find really helpful when I'm traveling is to sleep on the plane. A lot of times I'll go to sleep and have makes the whole trip seem much less oppressive. And so, hydrating, sleeping, moving around frequently, and not eating definitely seems to be a benefit. But I wouldn't necessarily say water only fasting, just because we definitely don't want to get into dehydration or end up with some healing crisis on the plane.
Yeah, you can take liquid as long as you bought them after you went through TSA,
Right.
You know what always happens to me on an airplane is I get, not on the plane, but the night that I get to my destination, I get these horrible leg cramps, which I never have except when flying. What
Well,
is
I
it?
think it's because you are getting dehydrated, AJ. So
Oh,
dehydration is associated with leg cramping, and and also you're probably not used to sitting in an uncomfortable chair for extended periods of time. So
you're probably right, Dr. Goldhammer, because I think I drink less when I'm on a plane because it's so hard to go to the bathroom because they
right,
don't want you to get up and there's a line. Yeah, okay, that
yeah.
makes a lot of sense.
So that's the advantage of like always having aisle seats too. I know I always like to have an aisle seat. Plus, if somebody's annoying, you can always trip them up and stuff. So
Yeah, I do prefer the aisle, but you have a smaller place to put your stuff on the aisle seat. Okay,
yeah, that's why it's important not to bring any stuff.
yeah, okay. Well, we'll be flying this weekend. And by the way, if anybody wants to go to Rancho La Puerta and play basketball with me and Dr. Goldhamer, there is one spot left. So hurry
Oh
up.
boy.
Yeah, we're gonna have an
So you're
amazing.
going to let me teach you how to shoot free throws, huh,
Well, I
AJ?
am so worried though. We have a park near us, and a regulation size basketball is different than like the kind the kids have in my neighborhood. I mean, that thing, you have to like really, it's hard.
Well, I'm going to show you how to do it with your body, though, not with your arms.
Good, because I got some shoulder things. I'm
Yeah,
excited.
yeah. So we'll do it. You can use the body so that you can overcome the fact that the thing's 10 feet high.
I cannot wait. All right. So this is from Speed Bump. I know Dr. Goldhamer is not for a fully raw diet, but my question is, what is your experience and what being raw was like for you? I don't know if you ever were raw, so you'll answer
Sure.
that. I'm learned about it from Dr. LIsle, but I'm intrigued about your experience. And many doctors say that cooked kale or broccoli is not as healthy as raw, but I prefer them cooked and happily eat much more cooked. Is there really an energy benefit to raw?
Okay, so no, I think that raw foods are wonderful, and you want to eat large volumes of raw fruits and vegetables. They provide vitamins, minerals, water, fiber, and they provide satiety in the sense that they mechanically fill up the space, so you're less likely to overeat on the other foods. And by volume, half of your diet might be raw when you just do it by volume. But as far as calories, at 100 calories a pound, you're not going to live on raw vegetables. You'd need 20 pounds a day. And even fruit, even though it has 300 calories a pound, that would be like a full-time job and probably not that healthy. So we eat our fruits and vegetables, and then we get enough heat processed vegetables to get the caloric density we need in order to sustain our optimum health. It's interesting, AJ, you can have a horse eat just raw grass, but you can't work that horse because it wouldn't get enough calories. So that's why they serve horses grains, preferably cooked grains, in order to get enough calories to actually do work. So if you were going to be laying around in the tropics and not having to use your brain and think and work, you probably could get enough calories from a raw food only diet and not ever do anything. But since your biggest burner of glucose is your brain, people that are going to use their brain are going to need more caloric density. So if you're going to, of course, maybe politicians could live on a lot of this raw food only because they're not really using their brains too much. So maybe that would be something to investigate. But for most of us that are going to try to be cognitively active, eating enough caloric density to sustain optimum weight is necessary. Now, I did an experiment when I was a kid. I went on a raw food only diet for 6 months. And I did great. I felt wonderful, but I lost, got very, very skinny because it's hard to get the caloric density that you need. And what I found in practice is that people eating raw food diets typically get into problems. Sometimes it takes them 2 or 3 years, but they do eventually get into problems with teeth, nail, hair, emotional volatility, recurrent infections, bladder problems, because it ends up being a high sugar, high fat diet. And whether it's a high sugar, high fat diet from fruits and vegetables or a high sugar, fat diet from refined carbohydrates, in the long run, what works better for most patients is a diet that's high in raw fruits and vegetables with enough cooked materials like steamed starchy vegetables, so that they can maintain optimum weight, health, energy, vitality, and get the mineral content that they need. Most people on raw food diets are on really high sugar, high fat diets because they eat a lot of fruit and nuts. They don't get enough vegetables to neutralize it. Interestingly enough, though, the people that do get enough vegetables, usually with blenders and juicers and other things like that, often do okay. The problem is, and I got news for you, from a natural viewpoint, we've been using cooking to process our food since we've been humans. We've only been using blenders relatively recently. So from a natural standpoint, using heat to process and make more calories available from starchy vegetables is a very natural thing for human beings.
Thank you. This question is from Anonymous. And Anonymous would like to know, Dr. Goldhamer, what do you think about gut microbiome testing and using the probiotics they suggest to help with bloating that I get from meals and even from drinking water, especially since I had to take antibiotics for an infection 2 years ago? Would fasting help with the bloating more than the custom probiotics they're suggesting by Flora gut testing?
Okay. So although I don't see any big problem with probiotics, there's some evidence that symptomatically it may be helpful to people. The more important thing is to create an environment where the normal flora regrow. Once you take antibiotics and you have the damage that occurs from them, one way to reboot is just to eat a whole plant food diet diligently. It doesn't work for everybody quickly. And in those patients, we'll use fasting to reboot the gut microbiome. We actually did the first study looking at the changes in the gut microbiome in people after long-term fasting. We did it with Luigi Fontana from Washington University. The first paper in that series has come out. It appeared in the Lancet in preprints. And interestingly enough, that first paper showed that inflammatory markers go up in fasting. We subsequently have done a study showing that not only do they come down after fasting, they actually come down to a lower level by 6 weeks post-fasting. That particular article didn't mention that, and it left the conclusion that there could be dangers to people that, in fact, we don't believe actually exist. But in any case, the gut microbiome is like rebooting the hard drive in a computer in our experience with fasting. You know how your computer sometimes like locks up and then you turn it off and you turn it on and you don't know why, but it's working again. Well, you're kind of rebooting that hard drive, whatever. The same thing seems to happen to the body, including the gut microbiome during fasting. A normal, healthy person eating a plant-based diet is going to have somewhere around 1,000 different strain of organisms living in your gut. And that's kind of weird to think about, isn't it, AJ? 5 pounds of organisms eating, drinking, and defecating inside you. So they're just pooing away. And what they poo in you could be nasty products like TMA, trimethylamine oxidase, which is found in people eating lots of animal foods. They have different organisms than people eating lots of plant foods. And the plant eaters give off poo too, but it's like vitamin K and fertilizer. So if you want fertilizer instead of toxic waste, I'd suggest you eat predominantly plant foods. And if you want more TMA, then you eat animal foods. And so we're just learning, though, now how these different organisms interact together. So the people that are selling you expensive, customized probiotics are probably overestimating their ability to determine which organisms are present, what effect the probiotic has, and what it really means. Because at this point, we don't even know for sure how to interpret the 1,000 different strains that are there, because most people are not healthy. Only 12% of the population is metabolically healthy. Less than 3% of the population engage in what would be even most generously considered health-promoting habits. And as a consequence, even what is normal is a serious scientific question right now.
Thank you. You know, I just realized the last question, I don't know if you answered in its entirety, because the person implied that you were raw at one time, 100%. I don't think that's...
I did do a raw food diet for 6 months when I was in school. And as I said, I thrived on it. I did fine on it, except I got really, really skinny.
Yeah. Thank you. Okay. This question is from Rob. I read where a doctor said that if everyone were to fast for 7 days once a year, it would basically eradicate cancer potential. Is that accurate? I know a doctor that does a 7-day green juice fast twice yearly, Dr. Gabriel Cousins. I think fast participants drink around 2 green juices per day. Is minimal green juice an effective way to fast?
Well, there's no problem fasting on green juices. It's not fasting, it's modified feeding. So fasting by definition is water only. So, and will a week of fasting prevent everybody from getting cancer? I would say definitively no. That it may dramatically improve people's health, and we advocate it. We do advocate people do a longer period of fasting periodically as appropriate to their situation. But there's no evidence to suggest that all you have to do is just do a fast once a week a year, and then you're not going to get cancer. The developing of cancer is a complex process that involves genetics and involves diet and lifestyle, exposure, and luck. And as a consequence, it's very unreasonable to think that any single behavior, including fasting, is going to be sufficient to prevent this issue from ever arising. In fact, I think, AJ, that people that eat a whole plant food diet are going to be more vulnerable to getting cancer, not less. And the reason they're going to be more vulnerable...
Wait a minute. Wait a second. That's not good news.
No, it's actually not necessarily good news, but I think they're more vulnerable to getting cancer because they're going to live a lot longer. And if you live long enough, eventually your vulnerability for something breaking down is going to increase. So if you don't die from a heart attack, and you don't die from the diabetes, and you don't die from all the other diseases that meat eaters are going to die from, you'll live long enough, you have a better chance of eventually running into cancer. For example, smoking definitely reduces the chance of dying from lung cancer for the 80% of smokers that die from heart disease before they live long enough to grow the tumors. So if you wanted to have, say, cancer-safe cigarettes, all you'd have to do is make them more dangerous so that they kill people from a heart attack even earlier. And then they'd probably be out there advertising them as cancer-safe.
Wow, thank you. This is a question from Marie, and she would like to know, how many days does the typical person feel very tired at True North? Does energy come back once you're in ketosis?
Some people come in and never lose a step. Some people become tired during fasting and recover during refeeding. It really varies. Some people become exhausted early in fasting, but actually get their second energy during fasting. And so it's very difficult even to predict how a person's energy and response is going to be to fasting. But most people, their metabolic rate slows down, they slow down. We want them slowing down while they're fasting and resting and moving slowly. During recovery, it takes about half the length of the fast on average to get people back to more normal vitality and energy level. So a person with a 20-day fast, we'd expect a 10 days progressive recovery before they'd be able to get back to their more normal activities. And we recommend the length of the fast before they get into, high-level athletic performance type activities.
Thank you. Dr. Goldhamer, Faith would like to know, what do you think about the levels of pancreatic elastase in vegans compared to the general population as measured in fecal samples? Should the levels be as high in vegans since we don't necessarily eat the substrate?
Well, that's a really good question, but I don't know. And I think what we're going to need to do, AJ, is save that question. Maybe next month we can bring Dr. Myers, our director of research, on, and then she can answer the more technical questions that we need a scientist for, because as a clinician, that's not a question I'm prepared to answer.
Okay, well, thank you. And that's great. We'd love to have any of the people that work at the TrueNorth Health Center.
Yeah, I think we should try to
or
bring
train
on
you.
Dr. Myers. I think we should try to bring in some of the medical doctors that work at TrueNorth Health so people can ask questions that I'm not able to properly answer.
Well, you know who I'd love to have on? I don't know if he'd ever do it, is Dr. Peter Sultana.
Well, I'll talk to Dr. Sultan and we'll find a day that's going to be available for him and we'll get him to come on here. And yeah, he would be a wonderful person to have
I
on.
don't want
He's
to
a
introduce him to
fabulous
the
doctor.
world. I'm afraid to introduce him to the world because it's hard enough for me to just get my monthly appointment with him. If people see how fabulous he is, I'll never get to speak to him again. That's happened.
Yeah,
So
that's
that's a
definitely a
risk. Yeah,
possibility,
I'm
but
not sure
we'll
I ever want to
prioritize your
take that
visit,
risk.
AJ.
Yeah, absolutely. So this is an interesting question. And I also feel, because Dr. Lisle also has a regular show on this channel, the first Tuesday of the month, that I think he could add something to it as well. But Dr. Goldhamer, I know you'll know the answer. It is anonymous. Are there any risks to fasting if you're experiencing mental health issues unmedicated?
Yeah. Yes, there are risks, and the risks are that you can have a dramatic improvement. People won't recognize who you are. The reality is that fasting tends to be very helpful in people if if they start off fasting stable off medications, they typically do very well fasting. If they're medicated, again, you don't fast on neuropsych medications. Sometimes we'll do modified fasting and then try to wean medications. Those medications can become potentiated during fasting, and so it wouldn't be safe to try to fast while taking some of these neuropsych drugs.
Yep.
I want you to remember, though, that many of the people that are on the drugs for depression and anxiety, AJ, especially the serotonin uptake inhibitors, those drugs don't actually work long term. And so you want to read the book Anatomy of an Epidemic, and it really does a deep dive into the research on these drugs. And so these drugs can actually cause harm long term as they deactivate the D2 receptors in the brain. And when you try to withdraw them, you get anxiety and depression. And then you're mistakenly told it's because you have a biochemical defect. It's a defect that doesn't exist. It's actually a drug-like effect. And so long-term weaning off these drugs can be very difficult, but may be an important long-term strategy. And we've had tremendous results in patients that find now that they're on a healthy diet and lifestyle habits, their functioning with depression and anxiety is dramatically reduced without the medications. They're doing much better off the drugs than they ever did on the drugs.
Well, okay, so the person didn't say what maybe mental health issues they have, but the way I interpreted the question is that maybe like, could it make things worse? And what I mean, like I know that like I had to go to True North like 12 times before I fasted because I have anxiety. So
Right.
is fasting right for everyone with mental health issues, especially, you know, because
Well, no, of course not. No, fasting's not a panacea, but there's nothing about having, say, depression or anxiety that would prevent you from necessarily fasting. But you have to take into account each individual's circumstances and situation. Fasting is a very intense process, and for when it's appropriately used, it can be helpful, but it could also be very disruptive for people. And I would say there's more people, if you just took 100 people off the street, there's more people that would not be candidates than would-be candidates just because of their health circumstances, their drug use, and their attitudes and orientation.
Thank you. So this next question from Megan, we get this a lot. We should probably just tell her to fill out the health history questionnaire because she's saying how long would she need to go at True North and what is the cost? But you can't just
Okay.
answer that
What I
generally.
can tell you though is I can give you some general ideas. So it costs a couple $100 a night for however long you're going to stay is the least expensive way to go for a private room share bath. So a healthy person that has no drugs and no, the blood pressure, all that's normal. Those fasts are often 5 days, 7 days, 10 days. They're short. So a person that fasts for 5 days might be with us 8 days, so you figure, the week to 2 weeks kind of range. Somebody that comes in that, let's say they're pretty healthy, but they have high blood pressure. The blood pressure is 140 over 90. They're on a single medication. That person might, and they have, say, 20 pounds of extra weight to lose. That person is going to fast, 10 to 20 days. If they had a 3-week fast, they would be at optimum weight. They'd likely be at optimum blood pressure, be off medications. And they would probably be doing very well. Let's say a person has a large uterine fibroid tumor and they've got menorrhagia and dysmenorrhea and they've got PCOS and they're having challenges and they're 30 pounds overweight. That person might fast anywhere up to 40 days. And then we would be hopefully have enough of improvement that healthy diet would carry them on their way. So this is going to range from 5 to 40 days of fasting. It's going to be about half the length of the fast to recover. If people fill out the registration forms and call me, I'll give them a good guess about what kind of duration, in my experience, would make the most sense. But you're right, AJ, you never know for sure until you see how the person does fasting. That's why we have a really flexible scheduling policy. Person can book any amount of time. They're only charged however many nights they're there. So if they book 5 weeks, but they stay 5 days, it's 5 days. So we're really flexible in terms of letting people shorten any stay because we don't know what's ideal until you see how the person does. It's not that easy to extend stays because we tend to be booked up, but it's always easy to shorten them. So that's where our flexible scheduling policy protects people from having to worry too much about, not needing the time that they booked.
That's great. Thank you. Okay. This, oh, I don't know why people always want to be, oh, I can see. Okay, this is anonymous. And the person is asking,
It's amazing how many people have been given the name anonymous, isn't
no, it's just I think when it's well, I don't know why this microbiome one is
it?
anonymous,
I
but this
thought
one
that was
is
the
about
new popular name for people.
well, this one is about STDs, sexually transmitted diseases, and the person is asking if fasting could work for curing STDs or helping people get rid of them. The person has HPV, human papillomavirus. They got it a couple months ago, and they know that certain viruses can cause uterus cancer. They got a particularly high risk variety. So sorry about that. They are a 26-year-old female with a pretty healthy lifestyle, exercise, and eating predominantly whole food plant-based. Will that alone help cure it faster, or will fasting help me more? I'm afraid of the negative consequences of the STD for my health in the future.
Yeah, it's interesting. We haven't published anything on HPV yet, but the general clinical observation is that people do seem to get improved as they improve their health. It doesn't mean that conventional treatment may not be an option for people, but it's almost never a bad idea to get people healthier. So fasting, diet, and lifestyle changes, and then you have to evaluate the clinical situation. And again, we haven't published anything specifically looking at HPV, so we're not sure how to tell you exactly what the likelihood of fasting is on viral shedding, et cetera.
Thanks so much. Carol would like to know What do you think about allergy testing like the IgG food test?
Mhm. Yeah, there's a lot of allergy tests out there. They're interesting. They're not tremendously reliable in my experience, in that a lot of times you'll test positive for whatever you've been exposed to. What I prefer to do is do water fasting, and then after fasting, do rotational feeding, looking for food-related allergies. If it has been ALCAT testing done or IgG media testing, always look at the data, because sometimes it'll point to little clues that'll help us with our rotational feeding, by avoiding foods that you might be sensitive to. But if you look at those patients after fasting and retest them, they get completely different results. So I don't know that it's giving us the clinical data that we actually want, but certainly it's interesting. And again, that's not an area that we've critically looked at stuff. So just my general clinical observation is I don't like people to have to spend large amounts of money on testing before fasting, because I don't know that it really changes what we're going to do. And then if there's still sensitivity after fasting, they can always empty their wallets and order the tests, and we can certainly try to help them interpret them.
That's a good idea. Okay, here's an interesting question, because when I've been there, I've seen people use TrueNorth as a way to get off cigarettes. And Summer would like to know, um, does do you help cigarette smokers deal with nicotine cravings while at TrueNorth?
Yeah. You know what's amazing, AJ, is by the second, or in some cases the third day of fasting, there's virtually no physiological cravings left. Now, some people say, yeah, that's because people are so miserable fasting that they don't even think about the cigarette withdrawal, that that's such a minor issue compared to the misery of fasting. But the reality is that's not true. The reality is that the processes, the biochemical process of withdrawal, are greatly facilitated during fasting. So withdrawal is greatly facilitated. Many people have reported how much dramatically easier it's been for them to get free of cigarettes with fasting than it was when they were doing it, feeding and stuff. But it's never easy to quit. Nicotine is a powerfully addictive drug, works directly in your brain, and it's very, very compelling for people that are addicted to it. But yeah, if you fast, you will definitely quit, because we don't have any smoking going on during fasting or any other addictive behaviors. So.
Right. Okay. I want to respect your time. If you have a hard stop, we're actually going back to questions from 2022, believe it or not. You get so many. That's why we're not able to take them from the chat. But you just tell me if you'd like to stop and come back next month, or if we should attempt to answer just a couple of more.
Well, if we can answer whatever you've got in front of you, I don't want to leave questions on the table.
Thank you. Okay. Well, Nadine would like to know, have you ever thought about opening another TrueNorth Health Center on the East Coast?
Yes. In fact, we would very much like to see one of the doctors that we've trained open up a facility on the East Coast. Dr. Stefan Esser is one of my favorite people. He's in Florida, and he's actually getting himself positioned to do that. He's already trained with us. He went to Harvard. He worked for Mayo Clinic. He's got some land in Florida, and we're hoping that he will eventually figure out how to get a True North East opened up. And he would definitely be eminently qualified. He's a wonderful doctor, and I would heartily support him and any facility that he were to be able to get up and operating.
Great. Thank you. This is from Kathy, and she says, I'm vegan and mostly eat whole foods. However, my social life revolves around eating out for the most part, so I'm not totally SOS free. Plus, the pleasure trap is strong in me, and I succumb to processed convenient foods here and there. My cholesterol and triglycerides are up, and my doctor wants me on a statin. I walk 6 to 7 days a week, eat lots of greens and cruciferous vegetables. At 70 and also a type 2 diabetic, do you think I should take it for a while and then get it lowered, or just get super strict about the SOS free and see what happens?
Well, first of all, statin medications don't necessarily reduce your risk of dying particularly well. They're not as effective as people are led to believe. Second of all, they often cause serious secondary side effects. So rather than poisoning yourself with a drug, what I'd rather see you do is tighten up the screws and reduce the salt, the oil, the sugar, and bring your lipids down naturally. And if they don't come down quickly enough, maybe we could try to do some fasting to see if that might help facilitate the transition. But most patients, if they're willing to do the diet, the sleep, and the exercise, are able to normalize their lipids enough that the need for these exogenous medications can be reduced. And just keep in mind, though, if you really look at the literature carefully, a person that's on a healthy diet with a low CRP and other low risk factors, dropping their cholesterol further artificially with statins doesn't necessarily have the profound reduction in risk for heart attack that people are led to believe. It's also true, interesting enough, with blood pressure medications, AJ. Blood pressure medications will lower your risk of stroke, but they won't lower your risk of heart attack. And so a lot of people, worrying about heart attacks are taking drugs that cause chronic cough, fatigue, impotence, and even premature death, thinking that they're doing themselves a favor, and that's not always the case. And yet, in a study we did with 174 consecutive patients with high blood pressure, 174 people were able to lower their pressure low enough to eliminate the need for medication. So I would be very optimistic that the need for medication can be dramatically reduced in the vast majority of people. We recently did a prospective study with our colleague from the Mayo Clinic, and 28 out of the 29 people had normal blood pressure without drugs at 6-week follow-up, and 75% of the people at 1 year that we tracked were able to maintain their weight loss and their blood pressure without the need for drugs. So it clearly shows that some people, if they're highly motivated, are able to normalize weight and keep it off, and they're able to normalize blood pressure and keep off the drugs.
Wow, that's fantastic. So we should have a rule, one question per person, but Nat has like 5 questions. Maybe you can answer.
I don't know. Well, 5 good questions are great.
Okay, well, maybe you answer them rapid fire. So Nat would like to know, what's the healthiest way to eat nuts or seeds to absorb the most nutrients? Is it raw, ground, soaked, fermented, sprouted, as a nut butter?
Well, you definitely, if you're going to eat them raw, you want to really chew them to a cream. If you soak them, sometimes that makes it easier to chew them to a cream. Or if you grind them into a powder, that obviously improves the breaking down. If you're eating nuts or seeds and you see them in your stools, that's a sign that you didn't chew them up because they didn't put themselves back together. So, that's always a good goal. So if you're going to eat something, you want to actually get it absorbed and digested. And so seeds definitely would be ground. Nuts could be ground, or it could be chewed thoroughly, or it could be soaked or sprouted. The advantage to soaking them is they get twice as big, so you might eat half as many. So that would be good. Overeating is a potential problem with these very concentrated substances. We recommend no more than about an ounce a day for most people.
Thank you. Okay, and then she'd like to know, do you advise people to consume algae or seaweed for iodine or general health? If not, why not? And if so, which one?
Yeah, I'm not a big algae fan. Algae is essentially pond scum. It tends to grow on polluted lakes, and I'm not sure that's the best. And I know there are some people growing it now specifically for food grade. That might be a little bit better. But kelp is really, really high in iodine, unbelievably high. You just need a tiny little bit of it. Nori sheets have very little sodium, and a couple nori sheets have your allocation of iodine. So, I don't mind small amounts of sea vegetables in the diet, but I would rather use the sea lettuces and things rather than necessarily the pond scum. But that's just my personal preference.
How do you really feel? Thank you. Should people in a coma be getting food, or should they be fasted?
I have no experience clinically managing coma patients, and so I really don't have an opinion. It's not something I'll be doing. It's not something I've studied. I'd defer that to people that are, have experience working with patients in coma.
That would be great. Thank you. Okay. Should we have fruit as a dessert or as an appetizer?
Well, I think you should have fruit as a part of a healthy meal. So if you have one meal a day that has fruit and lots of greens, that might be a perfectly way to do it. If when people say dessert, what does that mean? You eat till you're full and then you want to eat more, and so you take some kind of highly concentrated substance to have you eat more. I'm not sure I'm a big fan of dessert, but let's say, for example, you wanted to have an additional meal during the day. Let's say you had a meal in the morning, you had lunch, and you wanted to have a meal in the afternoon. Maybe that would be some fruit, because fruit digests pretty quickly. It may not necessarily get rid of so it blunts your appropriate healthy appetite in the evening. I'm not a big fan of eating 3 to 4 hours before you go to bed, so I wouldn't be recommending eating a lot of fruit late at night. The advantage to fruit, it's low caloric density. The disadvantage is pretty high sugar, so it tends to stimulate insulin response unless you're getting it with lots of greens. So I take fruit as a part of a meal. And, systematicating for most people 3 meals a day. You have breakfast, you have lunch, you have dinner, you do it in an 8-hour window. You don't really need to be eating in between that for most people.
Yeah, thank you. And what are your thoughts on psyllium husk?
Well, it's a bulking agent. Some people are looking to, because they're usually not eating enough vegetable materials, may have some trouble with stools. And so it may be have some therapeutic application. It's not something I incorporate into our diet at the TrueNorth Health Center or my diet, but do you have experience with psyllium at all?
Well, I mean, my understanding is that Metamucil is psyllium, but psyllium isn't Metamucil. Metamucil adds other things like flavors. I only have experience with psyllium as a chef before, because I went to culinary school 25 years ago, and chia seeds were not a thing back then that we could readily get. And what I use now, if I'm trying to thicken something like a dessert or a fruit jam that's made from just fruit, I will use white chia seeds now. But 25 years ago, I didn't know about those. So psyllium husk was used for thickening. I only use it now when I'm making the raw wraps that you make at the center, because you need 2 tablespoons to get the pliability.
Is Ramses using psyllium?
Well, I don't know, because I never get to, he never answered me.
Well,
So
we should ask him because I think he's figured out a way to do it without the psyllium. He's using something, but I don't know if it's something. But anyway, so the point is, I don't see any harm in. I can't get the chia pets out of my head whenever I think about chia seeds. That always just freaks me out a little bit. But as far as from a nutrition standpoint, I don't know that there's any problem per se. It's just I don't have a lot of experience with it, so.
I'm going to text Ramses now. He's probably busy working, but if he
Yeah,
answers,
find out what he
let you
uses
know.
in the wraps because those are delicious, and we've added a nice variety of stuff. We had them just the other day, but I wasn't aware that he used psyllium in there.
Well, the recipe calls for 2 tablespoons of either flax or chia, or 2 tablespoons of psyllium, and that's so that you can roll them. And who was it that told you about the wraps?
He's using flax, I think is what
No,
it
it
is.
has, okay, my understanding is it has to have the flax plus the psyllium, the chia plus the psyllium, or they'll break. But I'm going to text him and see
Oh,
if I can find out today.
well,
And
they
if I don't
weren't
find out
breaking, so
today,
yeah.
I'll
Yeah,
let
you
you know
told
in
me
next.
about that, and I thought that was probably nonsense and was very skeptical. And then I got the book, and then Ramses got the silicone things, and we use them routinely.
Okay, I'm texting him. I don't know.
We even got a commercial dryer for those, AJ, a big, large, it's like, half the height of a person. And it's worked really well.
Fantastic. Well, I hope when I come this year, I get them, because you got the book after I left. So I'm very excited.
Okay.
And her
Well,
last,
make sure you tell Ramses he must make those while you're there. So.
I sure hope so. Last question from her, but there's more questions. What are your thoughts on fasting Alzheimer's patients?
So in my experience, Alzheimer's patients, like any patients, may get health improvement, but it doesn't reverse Alzheimer's disease. Now, I know many people say, well, wait a second, you published cases showing people diagnosed with Alzheimer's disease came good. But those people didn't have Alzheimer's disease, they had polypharmacy. So they were misdiagnosed as having dementia secondary to polypharmacy. You get them off the drugs and then they wake up. I also had a patient that was diagnosed as dementia that was a MS patient that had a bladder infection. And ironically, AJ, this patient was brought in and we treated this patient, believe it or not, with antibiotics. And Dr. Sultana diagnosed the patient, treated him with antibiotics, resolved the infection, the person woke up. And then we had to, of course, deal with the consequences of the antibiotics and sort out with the diet and stuff. But the point is, there's a lot of people that are told that their problems are one thing, but maybe another. And so when they get well, they think, oh, we reversed their dementia, but we didn't really reverse their dementia. When it's actually Alzheimer's disease, I haven't seen that reversed. Now, can you prevent it? Can you slow it? Yeah, probably with healthful living. We know that exercise increases BDNF, and so does fasting. And BDNF is brain-derived neurotrophic factor that prevents oxidative damage in the brain cells. In fact, if you take rats, Walter Longo cites a study. They had 30 rats that were genetically bred, and 30 rats, the same 30 rats, the same kind of rats. The only difference was they gave half of the rats a wheel in the cage where they could exercise. And the rats that lived in the cages with the wheel exercised and they didn't get dementia. And the rats that lived without the ability to exercise got dementia. And they wondered why. And they found out that the rats that exercised had dramatically higher BDNF, brain-derived neurotrophic factor. Exercise increases BDNF, fasting increases BDNF.
Great. Thank you. Well, are you sure you want to keep going, Dr. Goldhamer? I don't want you to miss your lunch.
No, I've got 2 more minutes.
Okay, great. Well, then we'll try to get through a few from the chat, even though there's a couple that were submitted, and I'll get to those next month. What do you think of another doctor's green smoothie protocol? 10 to 16 ounces raw greens, half a cup of chia seeds, a cup or two of frozen fruit.
What are we doing with it?
It's like a hyper nourishment.
Okay. Well, if a person is underweight and we're having trouble putting weight on them, sometimes we'll use these more highly processed foods and smoothies and that kind of stuff. But for people trying to lose weight, we generally recommend whole food. So we'd want, berries and melon. We want lots of salads, steamed vegetables, whole food. Easier to progressively lose weight. If you're trying to gain weight, sometimes, more processing might be useful. And I don't hear anything in that smoothie that's particularly a problem per se. As long as the foods you're eating processed are the same foods you'd be eating whole, I wouldn't generally have an objection to it unless the goal is weight loss.
Thank you. And then somebody's asking how many hours a day can you fast? Is 20 hours too much?
Yeah, well, there's good evidence supporting 12 hours on a daily basis. There's our experience, we can go up to 16 hours. When you go over that, you tend to get into that gluconeogenesis problem where you start breaking down lean tissue. So we would recommend every day for 12 to 16 hours, and then occasionally a longer fast where you get the benefit of, rest in a controlled environment.
Yeah. Patty wants to know if you can drink carbonated water on a fast. You even have that really cool machine.
Yeah. So what we do is we take our distilled water and we carbonate it for people that are having nausea early in fasting. There is some evidence that carbonated water may help soothe the belly in terms of nausea, and it helps if people need it. I don't recommend it routinely. I wouldn't encourage people to use it as a routine thing. But for early phase fasting, we find it useful. And also, for example, if people are out at some party and everybody's becoming intoxicated with mind-damaging alcohol and stuff, and you want to kind of fit in, maybe you have a carbonated water so they don't notice that you're not indulging in their short-term pleasure-seeking self-indulgent behavior.
Thanks. Jean says, is she a candidate for fasting under a doctor's supervision with the condition polycythemia?
Yes, polycythemia does require appropriate supervision, but is not. We have lots and lots of patients that have been able to successfully fast with polycythemia. Sometimes it depends on what your counts are, et cetera, but that would not be a condition that would rule out the consideration of fasting.
Great. Dr. Goldhamer, this was great. I'm going to say goodbye to the people. You can log off while I do that and tell them to get your book, and then I'll have a link below. And if they want to come to Mexico, there's still one shot. Please get my book too, so I can become a New York Times bestseller. You need to get it early and get over $1,000 worth of bonuses. Links below. Dr. Goldhamer very reluctantly endorsed the book, but he wanted the title to be Desserts That Won't Kill You. Thanks so much.
I actually said desserts to die for, but that won't kill you.
Yeah. Okay, well, it was a great title, and maybe my next book will be that. Like, thank you so much, Dr. Goldhamer. Look forward to seeing you here on Chef AJ and Friends next month, and look forward to seeing you at Rancho La Puerta for basketball on Saturday. Thanks for watching, everyone. Our next show will not be till Sunday, August 25th live, because I will be